Hi everybody, it's Lori. I'm here to talk to you today about the side effects with GLP-1. I know I've done videos on this before, but this is one of their main concerns besides the cost and availability. But a lot of people get side effects, and that's the number one asked for topic of the videos. So let's start off with that. I've been on the GLP-1 medication, tirzepatide, for a year now. I've lost 60 pounds. I'm not a doctor. I don't pretend to be one. I'll always point you back to your healthcare provider. But I have learned something in my year of taking it, and hopefully you'll learn from my experience. So they put you on starter dose for a reason. Get your body used to it, because people get side effects. Most common side effects: nausea, vomiting, diarrhea, and constipation. I think they say something like 25% of people get the nausea. That's a big number of people. There's stuff you could do for the nausea, like you could watch what you eat. You cannot have spicy foods. Number one thing to do with all side effects is hydration. Water, water, water is the answer to a lot of problems. The way that the GLP-1 medication works is it sends a signal to slow down your digestive system, so your stomach empties slower, so that you'll feel full faster and for a longer period of time. It also sends a signal to the pancreas to secrete some insulin to prevent blood sugar spikes. And it sends a signal to the brain that says, hey, I'm satisfied. I'm pretty full. I don't need to eat the whole pizza. The one piece is enough. Now, hopefully you're eating a little healthier than pizza, but that's just an example. So you start taking it. It's not uncommon for the first couple of weeks to get some of the nausea. And again, water and watching what you eat. And if you're vomiting, especially take care of the hydration, because being dehydrated will make things even worse. So there's some over-the-counter things you could take, like Pepto-Bismol. You also have to be careful because it also sometimes creates some acid reflux, which a lot of people have anyhow. But again, watching what you eat, spicy foods, and so forth help with that. There's also medication, either over the counter or prescription, which helps with that. But you also have to be careful, because that takes away the symptoms. It doesn't mean you don't have acid reflux. And since you still have it, you may be coughing a lot and think that you're allergic to something, or there's something in the air, but it could actually be from the acid reflux. Just a little thought to keep in mind. Again, check with your healthcare provider if it persists longer. And I've been fortunate. I really haven't had any side effects, but this is what people have told me. I have had acid reflux, and I've taken medication, prescription medication for it. So like I said, it's not that I don't have acid reflux, it's just I don't have the symptoms, and the medication really hasn't given me any more symptoms. Now, the next one, of course, is vomiting, which nobody likes to vomit. I haven't met too many people that really like to vomit. It's uncomfortable. It's just not a good thing. Again, you have to be very careful with your hydration, because if you can't keep the water down, it's not doing you a lot of good, and you may have to get hydrated with an IV or something like that. So keep that in mind. Keep your hydration going. Even if you are vomiting a little bit, hopefully you're keeping enough of the water down so that you don't get dehydrated. Next common problem is diarrhea. Here I am on the internet yet again talking about poop, but it happens. And again, watching what you eat, not having a lot of fatty foods. You could let it take its course. You could take over-the-counter medications for it. Fiber helps. Fiber is the answer to a lot of the problems. Fiber also helps If you're constipated, which is the other problem that's a very common problem, you could take stool softeners. I found taking magnesium at night is great. I personally like Bio-Optimizer, which is 7 different kinds of magnesium. A lot of people have a magnesium deficiency, but that's a whole nother subject. So there's many brands of magnesium, but it does help with constipation. Again, water and increasing your fiber, making sure that you're having enough leafy vegetables and fruit will also help, because you still want to eat healthy, because this is going to be your way of life from now on. It's a lifestyle change. Not to say that you're never going to, eat anything bad again, because we all know that we will. But so we've covered the nausea, the vomiting, the constipation, and the diarrhea. Other side effects, if you're prone to gallbladder disease, it's a small chance, but it does tend to increase the fact that you may have a gallbladder attack. And again, consult your physician, because the same GLP-1 medication that slows down your digestion could also affect the gallbladder. I know people that have, before they've been on the medication, have had to have their gallbladder taken out, and people that have been prone to gallbladder disease while they were on the medication have had to have their gallbladder out, which you have to stop for a while for the surgery, and then you can continue it a couple weeks after, and whatever your physician or nurse practitioner or whatever tells you, that's what you follow. And another rare but side effect that happens every now and then is pancreatitis. That is not fun. A lot of times it involves IV hydration, medication, and a lot of vomiting, a lot of severe pain. And again, if you have any of these symptoms for more than a couple of days, consult your healthcare practitioner, because these aren't fun things, and they're nothing to play with. It's important. Another very rare effect, but can happen, is certain types of thyroid cancer. You probably should not take this medication, because there have been studies in mice that have shown that certain types of thyroid cancer gets worse with the medication, but that's a study done on mice. Mice and people are totally different. So again, check with your healthcare provider first. If you have a family history or a history of that type of thyroid cancer, this medication may not be for you. So we've covered the most common types of side effects. They're really a small percentage, people that have them. And again, more common when you first start taking them or titrate up. Again, I personally use LMNT, Element Electrolytes, which, if I do think I'm feeling a little bit nauseated, I sip on that all day, and it tends to go away. Plus it keeps me hydrated, and gives me a lot of electrolytes, which are important. And that's you should know what the side effects are, and what to do if you have them. They're nothing to really worry about, as long as you're educated about them and you handle it properly. So hopefully we've taken some of that fear away from you, and hopefully this helped. Please like and subscribe. It really does help the channel, because I want to continue giving you information, because information is powerful. And we all need power to get us through our weight journey. And that about wraps it up. So have a good day.